LGBTQ Health and Pandemic. Since February 2020, this segment has been unique in America, answering your LGBTQ community questions about our unique health needs. We are proud to have Queer News Tonight health anchor Dr. Howard Grossman.
He is an American pioneer in HIV/AIDS medical treatment and was the executive director of the American Academy of HIV Medicine. He is a nationally recognized medical expert and proud LGBTQ community.
Well, good evening, Dr. Grossman. And before we move into viewer questions tonight, I want to give you an opportunity to tell us about some of your thoughts over in this week's health news for our community.
Can you hear me this week, Al?
And to production, I hear Dr. Grossman, but a little more volume.
Okay, so you can hear me?
Yes, yeah.
Okay, that's a big change from last. Well, it was interesting. I have to tell you, Al, I was in Chicago this weekend to meet with some friends, and Chicago has put a mask mandate back in place, indoor activities. And, you know, most people are adhering to it. There were exceptions because it's new to see that most people were following along. So, you know, we keep talking about how there are really two different epidemics in places where most people are vaccinated, in places where most people aren't. And I think we're really seeing that play out.
Yeah. Let's jump right into the questions that we Howard.
A new study shows the Moderna vaccine produces twice as many antibodies as the Pfizer. If I got the Pfizer vaccine, should I get a Moderna booster?
Is any evidence to support that at all? And, you know, twice as many, the question is whether that's statistically significant. So, you know, that's really what I'm not sure that it is. When you say that these boosters, all of them, raise antibody levels by 11-fold, what does twice matter?
See, so just for clarity, you don't think that it makes much difference regardless of which vaccine you've taken?
Moderna or Pfizer, they're both the same mechanisms of action. I think they've had about equal efficacy. You know, I don't think there's much difference personally. You know, but the whole question of the third vaccine is that's something that's been coming up a lot. Everybody asks about it. They said 8 months. Now they're saying maybe 6 months. I mean, clearly at this point, if anybody's immunosuppressed or on an immunosuppressive drug, like for psoriasis or for Crohn's disease, or transplant patients, should be getting that third booster as soon as possible. And they've put out information that the third booster is okay 28 days after the second dose. Mm-hmm. For people who are not immunosuppressed, you know, it's still a question of when to get the third. But I think if you're older, you know, if you have comorbidities, those are good reasons to get that, you know, within that 6-month window. And the question is also if by January we will have a new vaccine to fight against some of these variants. So we may need to get vaccinated again.
Yeah. Okay.
Great. Another question is Cam Newton, one of the top.
Just one thing, just to remind everybody that we are in flu shot season. So all the pharmacies have flu shots. Publix has, you know, a lot of the pharmacies have it, and people should go ahead and get that now.
Great. So Cam Newton, one of the top quarterbacks in the NFL, was cut from the Patriots roster for being unvaccinated. Do you think more?
You know, I think it's going to depend on the owners and depend on where they are. I would expect, you know, if I was a football player and I was in that locker room with people and I was in a huddle with somebody, I'd sure want them to be vaccinated, you know, before they start crashing into me.
All right, Dr. Grossman, it's nice to see you again. So a judge in Ohio ordered a hospital to treat a patient with Ivermectin. What are your thoughts on this?
Nice to see you too, Lexi. You know, obviously, you know what my thoughts are going to be. First of all, that judge should be tried for malpractice. I mean, he's practicing medicine without a license and committing malpractice to boot. Ivermectin is a drug that, as you keep hearing, is used to treat parasites in horses and large farm animals. We do use it in humans to treat scabies, but as a single dose, because more than that is toxic. And there was some interest in ivermectin back at the beginning of the pandemic, and really the toxicities were too high, and it didn't do anything. So the fact that these faux news people and InfoWars and the rest of them are putting this out there is truthfully murderous. I mean, they're poisoning people.
Yeah. Howard, did you say faux news or Fox News? My IFB.
The same thing. It's the same thing, isn't it?
Yeah, all right. Well, that is tonight's Queer News Tonight's Q&A on LGBTQ plus health and pandemic. We're here every Tuesday with Dr. Howard Grossman to answer your questions. Do you need medical assistance? And of course you do. We're LGBT. We encourage you to contact Dr. Howard Grossman here in Wilton Manors and all across South Florida. Thank you again tonight, Tony. I'm sorry, Howard, and then we're